Have you got sharp pain on the top of your shoulder after a heavy fall or lifting something heavy? There is a chance that it could be an AC joint sprain. If it is, we are going to break down in this video what it is, what we can do about it, and the best exercises to get you back, what activities you enjoy doing the most. Welcome back, guys. It is Dr. Tom. Now, what is an AC joint sprain? A strain or a little bit of tearing to the ligament. So remember, ligaments join bone to bone, and the ligament that attaches the clavicle, so this collarbone at the front, to the acromion, which is part of the scapula on the back. So it forms the top of the shoulder joint. You'll often see with bad sprains, you can get what we call a cleft deformity. Collarbone, the end of the collarbone will actually start to lift a little bit. So even though this joint is small, it is essential for shoulder stability. So if you're someone that thinks that maybe the above has happened to you, there is a self-test you can do. So with the hand, you can come straight across the body, and often with this one, you'll feel with the adduction, it's starting to put too much pressure through that AC joint. So what are the main causes of an AC joint sprain? Number one, and the one I see, is a direct fall onto it. So I've had a lot of mountain bikers, footy players, where they fall directly on the outside of the shoulder, and that puts too much pressure through that AC joint, and in doing so, will disrupt the ligament. Overhead heavy lifting in poor form. So if you're doing something very incorrectly in the gym with a lot of weight, this can also put too much pressure on the AC or that ligament and cause an AC joint sprain. So what are the main symptoms of an AC joint sprain? Number one is pain, and pain directly on the ligament area, which is between these two bones here. Initially, you can have a bit of swelling and bruising, especially if there has been trauma to the area. So if you get bruising coming out, or it is, as you feel, it's quite warm across the area, that can be often a sign that there is ligament damage. Obviously, tenderness to touch. So if you go right on that little AC joint and press down on it, it's often very tender. That step or cleft deformity we were talking about before, where if you're sitting there, you'll often see it looks like a little wing or something coming up. Limited range of motion is a huge one. So anything overhead can get quite painful, and anything into adduction. You may have had a scan or be getting a scan, or just unsure of the different grading of AC ligament sprains. So when we talk about a grade 1, the ligament's intact, it's a little bit stretched, it's not too major, and we can 100% rehab this in most cases. Then we look at a grade 2, this is moderate, and this has a partial tear and a slight separation. We look at a grade 3, this is a severe tear, and there's a very obvious that cleft deformity forming and separation of the ligament. And grade 4 is extremely rare. It's a full dislocation with clavicle displacement. So initially with an AC joint injury, we often will rest, ice, allow things to settle. In a lot of cases, we may need to sling the actual arm, and then after a certain amount of weeks, then we go into the phase where an osteopath, a physical therapist, or a chiropractor come into things. And this is where we're gonna do some conservative treatment and also give you some great exercises to start to restore that range of motion, decrease the pain, and improve the strength through that whole shoulder complex. If you have been in a sling for a week or two, you're in a sling, it closes that pec off, it gets really tight through the pec. And our number one thing is we want to start to be able to open that shoulder again. So super basic one here, guys. We go about shoulder height, and then as we've done in previous videos, we're going to give a little 5% resistance into whatever we're pushing. So we're going to push the arm nice and lightly as you breathe in. And then as you breathe out, we're going to rotate away, increase the stretch through this pec region. Remember, there should be zero pain through the AC area. So little push again as you breathe in, 2, 1, breathe out, relax, rotate away, let the stretch increase. So after doing 7 reps of that, guys, we're gonna then get into the next exercise. We're gonna start on the wall with these ones. The closer our feet are into the wall, the easier it makes us. The further we step them back, the harder it makes it. Here we're gonna drop into the wall, bringing those shoulder blades together, but not bending these elbows. And then from here, try and spread and get as much distance between the shoulder blades as possible. So slowly dropping, letting those shoulder blades come together. And we're doing 10 reps here, slowly pressing out. And as we do this, I want you to try and imagine that we're keeping the distance between the ear and the shoulder at maximum. So we're not sort of lifting the shoulders and doing it from here. The shoulders are pulling down. We're stretching them out and down, and then bringing them back together. But that's exercise number 2, guys. Let's get into the next one. So if that one got a little too easy after a few weeks, if you want to increase the intensity of the exercise, what we can do here, we can start on our knees with this one as well. Slowly dropping those shoulder blades together, keeping those elbows straight though, and then lifting up, spreading the shoulder blades as far apart as possible, and we're completing 10 reps here. Now, if you want to go to the hardest version, obviously that's up on the toes, shoulder blades down, spreading as much as possible. And once again, you can guess the amount of reps. We're doing 10 reps here. Okay guys, so for the next one, we are going to be using a dowel stick. If you don't have a dowel stick at home, you can use a broomstick, get creative, whatever you've got around. You're gonna have the palms facing forwards, placing the dowel stick, behind the back. And then from here, as long as we don't feel any pain here, we're going to slowly, keeping the elbow straight, be going into a little bit of shoulder extension. So holding back for just 3 seconds and then slowly back from there. So once again, coming back, holding, 2, 1, slowly back from there. So we're doing 10 reps here. There shouldn't be zero pain. Try and do this from a good posture. Okay, now with the dowel stick, we are going to place it on the outside of the forearm, grab around, so twist the arm around the dowel stick. On the bottom here, we're just pulling that dowel stick and pulling that arm into a little bit of external rotation. So there should be zero pain here. And we're just gonna try and increase, get that range improving before we get into the next one, which is going to be pretty much the same as this, but adding a little bit of strength with a TheraBand. Okay guys, so this is a TheraBand, super cheap, super easy to get. I'll leave a link in the description. TheraBand around something stable. I want you coming up into a 90 position and then from here squeezing back. So from here, we're just gonna start with a 10-second squeeze back. After 10 seconds, a very slow release forward. So really not too much movement. There shouldn't be any pain with this. So squeezing back, holding for 10 seconds. We're doing just 5 reps here. And a slow release. As you squeeze back, if you remember those scap push-ups, as you squeeze back, I want you to focus on trying to squeeze that shoulder blade down and in towards the spine as well. So it's getting rotator cuff, those rhomboids, everything attached to the shoulder blade firing really well. So once we've done 5 reps, 10-second hold back, we should feel this muscle in the back of the shoulder, the rotator cuff muscles, starting to fire. And these muscles, if you didn't know before, are part of shoulder stability. So in getting back and allowing, once again, the AC joint to heal, if we have stronger and more controlled rotator cuff, this is going to help the AC joint get stronger and also take pressure out of it in the future, because as we know, ligaments never fully heal. They're always going to be slightly stretched. So in saying that, you're always going to have more chance of disrupting this AC joint. What we want to now also do is keeping the arm locked into the side, keeping the hand, so that elbow squeezing in against the hand, pressing against the ribs. And from here, squeezing out to 45 degrees. If that's, we want to load this a little bit of strength through here as well. So if that's easy, we can shuffle out a little bit. Coming out 45 degrees. This is just a 5-second hold, 10 repetitions, slowly releasing from there. So there should be this, you should feel that as you come back in, you almost want to shake a little bit, but we're going to try and smooth that out. And that's that eccentric control through the rotator cuff. For the last one, guys, this one here, we do not want to do it in the early stages of rehab. It is later. If you do it early, it's going to disrupt it. We're putting force through the AC joint area. And it's not going to be happy if we do it. So all you need is a wall here. We're going to be standing away from the wall. The further out from the wall you are, the harder it gets. So we're going to start pretty close in, and you're going to have your hand behind your back with the palm facing into the wall. From here, standing up nice and tall, locking the shoulder down, shoulder blade back, we're going to start to squeeze into the wall. So almost like we're trying to push our body off the wall here. Once again, we're going to hold here. This is going to be a 10-second push, and you're going to feel this burns. This is a muscle that we don't often use. If there is pain in the AC area, you are not ready for this exercise yet. So just wait, hold off for a few more weeks, keep doing the other exercises. If there's no pain, this is great. And this is going to strengthen that all and around that AC joint area. We are doing 5 repetitions here, guys. Okay, so we're gonna go semi-lunge position, little bit of bend through the knees, left foot forward, so the leg closest to the wall on the front. And then from here, inside arm's gonna be down nice and low. The arm we're focusing on is going to be, we're gonna go with the hand shoulder width height. And from here, we're going to start to keeping up nice and tall through the spine, press into the wall. So once again, 10-second hold, keeping the elbow straight, trying to press. Now, once again, this is a later stage rehab exercise. If you feel pain, once again, you're not ready. Wait a few more weeks, let all the other exercises take effect, and then we can do this one. So 10-second hold into the wall, and then you can come out from there, have a little rest. You might need to drop the arm down, especially if you're getting a little sore on the front of the shoulder. Come back up to shoulder height, go into that, what we call adduction, which generally disrupts that AC joint, but we're in the healing stages, so hopefully there is zero pain. And we're squeezing that arm straight across the body. The chest doesn't rotate into the wall either. The chest goes directly forward, and we're going adduction. So it's all shoulder movement. Don't cheat by rotating your chest in, and we're pressing into the wall. Okay guys, so I hope today's program works well for you. I hope you can get back into whatever you enjoy or a decrease in pain. Remember to like, share this with anyone that's done this injury, subscribe, it helps your channel out, and we will see you again next time, guys. Take care.